but excited to welcome to the program from Rural Lock, Doc Allen Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil, and you?
Fantastic. And today's topic is preventing postpartum depression. Can postpartum depression be prevented?
Well, I think so. There are a lot of people, though, that think that postpartum depression is mysterious and surprising. I think it's neither. It has to do with your prenatal course. Preventing depression is something you do during your prenatal course. It's a relationship that you establish with your providers. And I think it's really important to bring in dad and the kids because that's all part of the family unit. So yes, I think it can be prevented, although there are people who would disagree with that.
Why is postpartum depression increasing?
Well, I think there are several reasons, Neil. One is that I think we might actually be keeping better records, but I think that's a small part. Secondly, that we have obstacles to making a postpartum relationship or partnership, which I think is really important. And that, again, is what you develop in the prenatal course, that partnership. And finally, is you have a shorter hospital stay, and that's because insurance companies now dictate how long people can be in the hospital. You know, when I was a student and a resident, doctors could decide when patients went home. Today, insurance companies decide, and believe me, they don't care whether the patient is ready or not.
What do you mean by getting ready to go home?
Well, it's pretty simple. You know, we used to talk about, well, how's the baby eating? Can the baby latch on? Is the baby gaining weight? Baby losing weight? If you're breastfeeding, is the milk in? If you're bottle feeding, you know how to do that. And do you have an arrangement at home? In other words, who does what? Who gets up with the baby at 3 a.m.? Who is going to go grocery shopping? Who's going to do the meals, wash the dishes, clean the house? And when are you going to get some time off? So all of those things are things you need to know, really, I think, before you go home, and they all help prevent postpartum depression.
Yeah, that's so true. Okay, so let's move on to the next question. Is postpartum depression the same as depression unrelated to pregnancy?
Well, I'm sure there are a lot of people who think that it's true, that it is related. I think it isn't. However, I think there's one exception, and that is when a person has depression before pregnancy. So you can have both kinds of depression. You can have the depression before pregnancy and then superimposed, or on top of that, you can have postpartum depression. But postpartum depression is usually amenable to talking. In other words, division of labor. There's a lot of attention now being given to what they call the mother-baby dyad, which means mother and baby. But really, there's much more to it than that. It's mom, dad, baby, and all the kids at home. So those are, getting that stuff straightened out, how that's going to work. That's really important as far as treating postpartum depression. However, there are medications which can be used. People talk about SSRIs, that's selective serotonin reuptake inhibitors. I don't like them because it takes 2 weeks to get any results. For my patients, I always gave them Ativan because there's always an amount of anxiety and dread associated with postpartum depression. I can't take care of this baby. I don't like it. I don't want to see it. And then there's the SNRIs, and I think they're better. I like that. Effexor is one of those. I always gave that one because it helped motivation. In other words, the SSRIs, mom's perfectly happy to sit on the couch and watch TV and let the baby cry in the next room. But with the SNRIs, they feel better, and they also have ambition. So, and that's part of taking care of baby, is actually taking care of baby. There's also such a thing as going to see your psychologist or your psychiatrist. But the big problem that people have is that there is really no specific field of medicine that deals with postpartum depression or has a specialty in it. So it's hard for people to get good counseling.
Oh, it definitely so important. So the medical treatments are very useful with postpartum depression. It sounds like you were talking about, Doc.
I think they're very helpful. You just have to give the right ones at the right time.
All right, best place to go is worlddocallen.com, and also pick up Pregnancy Way, available today on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast.